Senator Whitmer.
Thank you, Madam President. I listened with great interest when the chairman of Judiciary stood up and said that House Bill 5711 was pro-woman. I got to tell you, you've kind of lost credibility with a lot of us since your actions over the last week were claimed to be pro-worker. And I have to tell you, I heard many of you scoff when I talked about the right-to-work legislation as being anti-woman. I'm going to let you know, in the private sector, the non-unionized jobs, women make 77 cents on the dollar to a man. Same education, same work ethic, same job. Women of color, it's 67 cents on the dollar. Unionized workers, equal pay. So yes, it's a woman's issue, and your policies are anti-woman. And after your actions of the last 2 years have undercut your credibility to claim that you are pro-woman and that that's what this legislature is all about. Let's look at one of the times you've thrust us into the national spotlight. And when I say you, I mean the Michigan Republican Party, with their sexist behavior of taking away women's microphones in the House of Representatives when they dared to say the word vagina, a medically appropriate word used to describe the female body part. And as a woman of 2 girls, that's how doctors tell me to educate my girls on their bodies. But for using that word, the microphone was taken away from 2 female legislators in the House. Their right to speech, their constituents were disenfranchised. And it led to such national attention that we performed the vagina monologues on the front steps of the Capitol with Eve Ensler. Now, this last election, I've seen Republicans across the country start to look at what happened and look at the results and say, wow, maybe we've been too extreme. Maybe binders full of women and the Murdochs and the Aikens of the world have led us to think we should maybe reconsider.
Senator Whitmer, if I could ask you to keep your remarks to the bill. Thank you.
Madam Chair, this is my no vote explanation. It is my constitutional right, and I'm going to talk about how anti-woman the Republican Party is. And that's what this bill is all about. As such, I would like this to be my no vote explanation, and I'd like my constitutional right to give that. So after this last election, there are Republicans across the country who are trying to figure out maybe we are too extreme, but not the Michigan Republican Party. The Michigan Republican Party learned a lesson that maybe you're not extreme enough. Maybe losing 7 seats in the House didn't teach you that lesson. Maybe Mitt Romney, your home state of Michigan guy, getting trounced by President Obama, and Debbie Stabenow trouncing Pete Hoekstra didn't teach you that. I'm going to read you yesterday's Free Press editorial in response to your action just days ago. It's entitled, "Lansing's War on Women Continued." And it says, talk about moving backward. 2 bills headed to Governor Rick Snyder's desk could transform Michigan overnight into the nation's most regressive state in terms of reproductive rights. Already, we're toying with reinventing Michigan as Mississippi economically with right-to-work legislation. Now legislators want to make this state a cultural backwater as well. 2 extreme measures were inserted into a package of bills to reform Blue Cross Blue Shield into a nonprofit mutual health insurer. An addendum to one would allow physicians and other health care providers to refuse to provide medical services to patients when there's a moral or conscientious objection, and allow employers to refuse to pay for services for the same reason. Another set of bills would require employers to offer and women to purchase an optional abortion insurance rider to have such services covered. When these bills land on his desk, the governor should send them back to the legislature and insist that these extreme anti-woman measures be excised. We support Blue Cross reforms, but not at the expense of women's reproductive freedom. Abortion is, by nature, an emergency response to an unforeseen circumstance, requiring months, if not years, of pre-planning in order to obtain insurance coverage is punitive, aimed at limiting women's constitutional right to seek abortion. The moral objection element is even more noxious. Michigan law already contains a conscientious objection for healthcare providers who don't want to provide abortion services. The new law is aimed at limiting women's ability to access birth control or emergency contraception. But the broad scope of the language gives wide latitude to healthcare providers who want to deny a patient any service deemed immoral. It allows them to opt out of anything, said Planned Parenthood head Lori Lamarand. As for the insurance rider, the language of the provision is murky. It refers to elective abortion, but doesn't really make clear what that means. As far as we know, it's unprecedented in the country. Hear that, Governor Snyder? More regressive than Alabama, more regressive than Georgia, more regressive than, yes, Mississippi, which typically defines itself at the bottom of any tally of social or economic progress. Young people already have plenty of reasons to eliminate Michigan as a place to live and work. For folks in the 18 to 34-year-old range, our state is scarcely on their radar. Will a brand new set of regressive policies change that? We don't think so either. Snyder's mission statement on Inauguration Day was simple: fix Michigan's economy. Make the state an easy place to do business. Make it a state where people want to live. Neither of these changes moves Michigan forward, and neither does the change in House Bill 5711. These restrictions won't do a thing to improve patient care or safety. In fact, they'll actually drive up health care costs for patients and drive health providers out of existence. These politically motivated regulations will make it more difficult for health centers to provide high-quality health care and only make it harder for women and couples to access critical reproductive health care services, including life-saving cancer screenings, contraception, STD prevention and treatment, and continued access to safe and compassionate abortion care. Denying women the basic health care is offensive, it's wrong, and it's out of touch. And I ask you to vote no on this hideous legislation.